All right. Good morning, everybody. Welcome to the November 23 meeting of the Maryland Lead Poisoning Prevention Commission, hot off of Lead Poisoning Prevention Awareness Week. I want to thank everybody I'm Ruth Ann Norton. I'm chair of the commission. I am the president and CEO of the Green and Healthy Homes Initiative. I want to thank everybody who worked hard and contributed to Lead Week across the state. I thought it was a great success. There was a wonderful workshop Baltimore City Health Department and partners produced in Baltimore. That was a great kickoff with the state agencies in Prince George's County, and appreciated the Prince George's County Health Commissioner for his post later that day. Lots of good work happening across the country during the week, but awareness is every day for this commission. So Wendy Phillips, if you would mind, let's take a quick roll call of the commission, and then we will go to minutes adoption, and then we will start the agenda.
Adam, you want to go ahead and start?
Sure. Adam Skolnick from the Maryland Multi-Housing Association, commission member.
Anna.
Hi, good morning. Anna Davis, commission member.
Barbara Moore.
Hi, I'm Barbara Moore. I'm the pediatric nurse practitioner and director of the lead poisoning program at Mount Washington Pediatric Hospital, commission member.
Benita Cooper.
Good morning, Benita Cooper with the Maryland Insurance Administration, commission member.
Okay. Cliff Mitchell.
I don't see him on. Oh, there he is.
He's
He is.
not on.
He's there. There he is.
He's not on. He's so not on at this point. Yes, Clifford Mitchell, Director of Environmental Health, Maryland Department of Health, commission member.
Okay. Is Jack Daniels still our representative, or has that switched?
So far, I've been trying to get an update from the governor's office, but we still do not have confirmation. So
Great, Jack. We are glad to have you. Thank you for being in Prince George's County. You were great.
No problem. Jack Daniels, CEA Lending and Risk Director for the Special Loans Program, current still commission member.
Right. It was a great view, right?
Yes.
Angela Paul.
Good morning. I'm Angela Paul from Maryland State Department of Education, nurse consultant for the Office of Child Care Early Learning. Thank you.
All right. The fantastic and wonderful Nicole Hart. Everybody's fantastic and wonderful, by the way.
Good morning. I'm Nicole Hart, Baltimore City Department of Housing and Community Development.
All right. Dr. Rogers.
Good morning. Good morning. I'm also commission member representing Maryland Chapter Academy of Pediatrics.
Thank you. Paula Montgomery.
Good morning, everyone. My name is Paula Montgomery. I'm a commission member representing Maryland Department of the Environment.
And Susan Kleinhammer.
Good morning. Good morning, everybody. Sue Kleinhammer, Lead Tech Services, accredited risk assessor, commission member.
Oh, feel better. It sounds like you got a little voice strain there.
Oh, thank you.
Wendy, did I miss anybody?
no, you have everybody.
Okay.
Here.
Fantastic.
Unless, is Christina on the line? Because I know I didn't see her name, but is Christina, are you calling in? No, I don't think so then. Okay.
Hello.
Oh, is this Jacob?
Hey, Jacob, I'm sorry I missed
this is
you.
Jacob. No worries. I'm calling in. I'm having some technical issues. I'm hoping to get on the video soon. Commission member, thank you for having me.
Thank you so much. And Wendy, if we could move to the minutes, if the commission if members have reviewed the minutes, are there any questions or comments of the minutes? Hearing none, could we get a motion to adopt the minutes?
Motion.
Can I get a second?
Second.
All in favor?
Yes.
Aye.
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 Aye. Aye.
Aye.
Okay, great. Friendly crowd this morning. Wendy, the minutes are adopted. just a couple of quick opening remarks. I don't see Delegate Atalia or Senator Carter on this morning. I did speak with Senator Carter. She stated that she's likely going to step down from the commission. I spoke with Senator Ferguson this morning, who has agreed to, who thinks the commission is extremely important. He comes from the Baltimore City education system, knows the importance of lead poisoning prevention, will be appointing a new member quickly. And I did, we are going to also follow up the delegate. And I did also speak with Delegate Rosenberg today, as he's been to help us with those conversations with Delegate Tyen's reappointment through the Speaker's office if there's need be to get legislative engagement. Delegate Rosenberg has been very active recently, wanting to assure that the proposed dust standards, which we'll talk about in a minute, are going to align with Maryland law, and if there's anything that we need to do there on the adoption, just for MDE to know the delegate wants to work on that issue. I will say at the top of this, a couple of things I want to cover, and then Paula Montgomery may take the helm of the commission for me, as I have a roof leak at my house and I have roofers arriving to deal with that emergency. But I did want to say very quickly that, as you may know, in Wendy Phillips's communication to commission members and interested parties, we are going to try to start back with more diligence hybrid meetings. So all are welcome to MDE's conference room for future meetings, but you'll also have the ability to be hybrid. A couple of things I wanted to bring to bear for consideration of discussion and making sure that we know about on a public basis. The EPA did issue final determination for lead emissions from aircraft engines. So this will have to go into play for all of our airports and aircraft coming out of Maryland to look at the standards around that. Jet aircraft used for commercial transport do not operate on fuel containing lead, but a lot of small airplanes and other airplanes do. So there are new standards coming out to de-lead the gasoline used. And we will say more about this in a future coverage of this, but I've asked Wes Stewart to please put the link in the chat so that you will be able to cover it, and we will cover it, as I said, in a presentation on the next commission meeting. Also, the FDA recently put out a health alert on Wanna Banana apple cinnamon fruit puree coming in pouches, and so there is a recall on those. What we are looking at and what the FDA is looking at is the use of these pouches that likely contain lead, not just for this product, but for all baby products coming in these pouches where lead is used as a stabilizer in production. So we've petitioned for the Consumer Product Safety Commission to take a look at this. Cliff, I really think we ought to look at it from a state level on this as well. But you know, it's not just the one product coming in these pouches, and if that's a contributing factor, I hope we'll be able to take a look at that. I don't know the role of the state health department in this, but certainly we want to protect our kids. I don't know if you have anything to say about that at this time.
So I guess what I would say is there are a significant number of products that we've been looking at, as you know, where lead's an issue, either because it's related to packaging or it's because it's related to things like growing the material itself. So it's intrinsic to the food. So, you know, both of those are challenges, especially when the material comes from outside of the state. We have much more control over manufacturing, processing, everything that happens in the state. We work very closely with MDA. We work very closely with MDE when we're talking about in-state manufacture of either food materials or, in some cases, stuff that is packaged where packaging is an issue. But if it comes from outside, most of our work is collaboratively with and through the FDA. And in very few cases do we have the means to control either the testing or the manufacturer. So that is very much a collaboration with our national and in some cases international partners.
I just didn't know if there are standards that the legislature or others should look at for anything produced here in Maryland. Otherwise, I understand the difficulties in that. But I think this is something that we do ask that people get out to parents. And I know we are going to have great caution about all of these materials coming in these houses until further notice, not just this one product. The last thing I wanted to bring to your attention that I think deserves a deeper look, but really important on awareness, is the recent article from the Journal of American Medicine, or JAMA, that said lead exposure might cause more deaths, IQ loss than expected. And what the study from JAMA that was published in their journal noted in September was that they estimate that lead through food, soil, and paint may have contributed for about 5.5 million adult cardiovascular deaths and a reduction of 765 million lost IQ points among children 5 years and under in 2019 alone. And that's an analysis of countries' blood lead levels. So it's not just the United States, but it does point to an issue that Bruce Lamphere covered yesterday in a talk with the George Washington School of Medicine, and that is the increasing knowledge of lead loading's impact on cardiac health and the increasing cardiovascular death. Ellen Silbergeld had prior done studies showing that there was a 16 to 19% increase in cardiac arrest for individuals exposed to lead. There is a 46% likelihood of early mortality. So it just underscores the importance of the work from all sources. And as JAMA reported, these estimates, or this study came out 6 times higher than they estimated that they were going to find. So I don't know, again, if Department of Health, either the city or state, want to comment on this, but we're posting the link here, not only for the public, you'll see this on the website for GHHI, but here in the link in the commission meeting, we think it is something to pay special attention to. The article reinforces the fact that a number of these, that the impact in low and middle income communities, regardless of country, are at a much, much greater rate. But Cliff, I don't know if you or Camille or others have something you want to add here.
So the only thing, well, there are several things to add about this. There's been a long history of concern about lead. Even without this just adds to a body of literature on lead and lead toxicity, which is cumulative, long-standing. You can't, as you know, divorce this from discussions of health equity, and the fact that it crosses across racial and ethnic lines, it doesn't mean that it doesn't have a disparate effect as well in certain populations that have increased stress, vulnerability, etc. So I think that this adds to, but doesn't fundamentally change any of our public health approach, and it adds to just a long history of knowing that this is a material that should not be in circulation. And I think that's my overall comment, that it's simply, it does strengthen that argument, but it doesn't fundamentally change it.
Are cardiac doctors cautioned about this at all? Preventive cardiologists, when they think about part of what they are talking to folks, and I say this, Cliff, because for years, because my father had 7 heart attacks,
yep,
2 cardiac arrests, 2 bypass surgeries, right? I've had a preventive cardiologist since I was in my 30s.
Yep.
Never once has a very great doctor ever mentioned this, that I ought to pay attention to my environment. And I wonder if there is an opportunity to do some grand rounds with preventive cardiology and preventive medicine a little bit more about this, and just raise the awareness that where people live or things that they are ingesting may have impact on their cardiac health.
So I don't want to speak ill of my fellow healthcare providers too much.
Don't do that, but is there an opportunity here? Right?
What I want to say is that in general, healthcare providers do not get a lot of training historically on any environmental issues. They are starting to get training related to the social determinants of health, which includes industry and occupation, which includes housing, which includes food. But it is not a strong suit of classic medical training to focus on that. And so I would just say we've got a long hill to climb generally with respect to environment and health, and you're starting to see it work its way into the curriculum, but we've got a long way to go.
Yeah, but we want to certainly help with that. I'm sure the state will do that. I don't know if there's other comments on that, but in the chat, Jonathan Riddick's put, can the state have warning labels placed on products that contain lead, like California? I think that's a legislative matter, likely, but something that maybe we should discuss. I have spoken with and would like to work together with the commission about providing a briefing to both judicial proceedings and the Environment Committee in the House coming up. And I think both would like a briefing on where we stand on lead. And these are all important issues to add in to the other work that we have, and including the importance of the ramp up that we're going to see with lead as we bring in the climate dollars that are requiring lead cleanup as part of its work. It's going to go fast scale, and the need for training. Yes, Cliff.
Yeah. So in response to Mr. Riddick's question, so one thing just to think about in this context, because this is something I think about a lot, which is we have legislation now that relates to PFAS in a wide variety, and it's a very widely, like lead, but for different reasons. It's a very widely distributed environmental contaminant. And so part of the challenge with respect to warning labels is filling up the warning label with so many things that the warning label becomes itself unreadable in a way, and dilutes from the message. So we do have to be smart, and we have to think smartly as a state about how we provide useful information without overloading that message with a lot of totally appropriate messages about ambient, low-level environmental toxins in our environment, which are making their way into the food supply. So I just leave that to you all to think about, because it's not just about lead, it's also about PFAS, it's about other persistent organic chemicals. And I'm happy to talk more about that, not here at the commission to take a lot of time, but just to tell you that it's something we are very interested in, and happy to have input in terms of how to think about it.
I think that's a great thing, a great way to look at that. Do we have other hands up? I don't know if we do.
No, there's nobody else.
Okay, can we put the agenda up? We will do follow-up on these, and I will follow up with the departments about the potential briefing for the House and Senate, and make sure that we have good, broad representation of all sectors on that. I am going to actually, Paula, turn the gavel over to you. I hope to be back to the meeting, but I have an outside emergency that I have to handle, and Paula Montgomery has gracefully agreed to take the gavel. Thank you.
Thank you, Ruth Ann. Good morning, everyone. We're going to go right on to new business, and we have several presentations today. The first will be presented by Camille Burke on the Baltimore City Health Department CLIP program, and it is the calendar year 2021 or 2022 report. So with that, Wendy will be presenting. The only thing I ask is, I'm not sure how Camille feels about this, but if we could maybe hold questions until she's done presenting, we would be very grateful. Take it away, Camille.
Thank you, Paula. You'll see a couple of years since we haven't done this technically since 19. I hope everyone can see the report. I will take this because this very well may be my last report to you all as the director of the lead poisoning prevention program. Please feel free to include other jurisdictions. I don't know how many other ways to say this, but other jurisdictions are doing amazing things, and they also need the commission's help. So please feel free to include other jurisdictions. Next slide, Wendy. Thank you. So everything we do, this is just one of my favorite pictures of the social determinants of health. It is by far, it encompasses everything that one would need for not only a healthy life, a healthy home. And I hope you all have seen this before, so I'm not going to spend a lot of time. Next slide, Wendy. These are the elements of a healthy community. We need this too, because this kind of takes it one step further. So yet again, you all will get copies of this, but wanted to include this as well. Next slide, Wendy. This is kind of small. So I actually have had this since I joined the department. This gives you lead poisoning data by fiscal year from 2000 to 2023. Literally, this is 23 years of data. I will say, and I'll have you look at 23 specifically where we are. And Fred may talk about this a little later. Those numbers seem a little low. Our testing numbers are wonky and all over the place right now. We will get 5 tests in one day and 35 the next. And some of that is folk going back to the doctors. Some of it is the lab. There's just a host of things that are going into those testing numbers. I know they're going to increase, and I know they're going to change just by the number of calls that we're getting and the number of visits that we're doing. But I just wanted to give that caveat, and I'm happy to talk about that a little later. Next slide, Wendy. This is the average time to a home visit. This is another thing that's going on that's really wonky. We're usually out doing visits there within 10 to 15 days. We've had lots of staffing changes. We had what I like to call the COVID retirement wave. Quite a few people right after COVID decided to go ahead and retire. You will see the very last one, which is 80, I think it's like 86 days. This is one particular client that we literally, I called, Yolanda called, there were 6 of us, and we finally convinced her to let us in the house. But it literally took us a minute, as you see, to get her to let us in the house. And that happens. We're just trying to get reacclimated and literally begging folk to let us back into their homes. So I wanted to show you that. Next slide, Wendy. And I'm sorry it's so small. 2020 sources, we did 2021, 2022. You'll see 2021 and 2022 possible sources. Hand-to-mouth activity was one thing that's listed a lot in our notes. Lead dust, lead paint. There are times yet again where we can't find a lead hazard. secondhand, there, and then there's just the unknown. And I'm happy you all see this, and I'm happy to talk about this a little later, but I just wanted you all to visually see it. Next slide, Wendy. 21. Here we are again. Looks a little different. You will see lead paint being, of course, the largest, but lead dust is catching up. Of course, hand-to-mouth activity again, because I wanted us to kind of pull that and tease that out, especially for our younger clients and our children. So I wanted you all to see that as well. And you will see this again. Next slide, Wendy. Here's 22. 22 looked completely different. It was more lead paint. Every year is different. Absolutely different. There's some consistencies, but every year is different, and wanted you all to take a peek at this one. Next slide, Wendy. So I would be remiss if I did not mention the COVID-19 impacts on blood lead testing. Of course, there were impacts on clinics, healthcare providers. We couldn't do in-person visits, clinic closures. Most of my staff was reassigned for COVID. Resources were shifted, and of course, there was little to no blood lead testing. Next slide, Wendy. I didn't know what to call this, but this is literally post-COVID stuff. I really had no idea what to call it. So we've had an influx of clients, which is great, but some clients have complained about obtaining appointments are difficult because providers are setting appointments differently. Folk just can't call 2 or 3 days before. It's a week, sometimes it's 2 weeks. Increased blood lead levels, which I'm sure everybody has seen. I, of course, talked about the difficulty getting clients to agree to in-person home visits. And I want to spend a little time right here because I think it's something that we know, but we kind of forget, which is healthcare workers' mental well-being has been adversely affected by COVID-19. And I can't say that enough, resulting in depression, anxiety, and a lot of stress. Want to make sure that folk know that it's okay not to be okay, but a lot of people are not okay. And this is hard work, going into people's homes, interacting with them every day. And recruitment for the health department in general has just been difficult. And we've had our partners at other health departments kind of indicate this as well. The other thing that's been odd and expected, but not something we thought about, was that there were quite a few things that were in place while COVID happened that have been removed. So additional resources. There were extra SNAP resources that are now gone for clients. So we now have increased food insecurity. There was an eviction moratorium, and it's caused extra anxiety and stress. And we're spending lots of time having conversations that there are funds for this. You can kind of go here for that. And before we can get to the lead, we have to get to some of the other life stuff that are affecting people as well. Next slide, Wendy. So our case management challenges have not changed. We're missing some information. Clients move. Our primary care providers are kind of giving us the information that they have, or they're just missing information. Completing a notice of defect with an adult staying in a house that they're not listed on the lease, and then they're afraid to complete it. They don't want to do it because they don't want to get the person that they're living with thrown out. We are, of course, experiencing hoarding, cleanliness. I talked about food insecurity and constantly changing phone numbers. None of that has actually changed. Next slide, Wendy. So outreach. We're continuing to do outreach with CBOs. We're lucky enough to still have our video up in the Mayor's Community Action Center, Head Starts, and we have partnerships with the Division on Aging. The Grandparents is Parents program is like one of our strongest partners because we have quite a few grandparents raising their grandchildren for a host of reasons. Next slide, Wendy. So partners, we're lucky enough to have great partners, and most of these partners are folk that you've heard of. DHCD, HABC, we meet with HUD. We, of course, have statewide case management meetings with MDH. We meet with MDE. Of course, GHHI is one of our great partners, maternal and child health, and we have regular contact with Mount Washington if needed. Next slide, Wendy. Partner highlight. Wanted to just shout out Mangela. She came out last week, and it is the most excited I've ever seen Mangela, and folk felt that excitement. And I'll share with you a little later, our lead event, it was one of the highlights of the day for our attendees. So thank you so, so much, Mangela. There's been so many amazing things in childcare that's happened. There's a new childcare portal that makes it so much easier for folk to apply for childcare. The income limit has been increased to $73K for parents. Maryland is leading the way in childcare assistance and scholarships. So I could not be more grateful for that presentation. Next slide, Wendy. So point of care testing. We began this way back in 2017. Our primary focus was administering follow-up tests in homes with our clients. However, we've shifted focus because our clients have shifted focus for us. We've shifted more to offering testing at Head Start locations. They have been our mainstay for the last 2 or 3 years. Literally every year they get 2, 3, 4, and I think we did almost 500 tests last year of just 6 or 7 Head Start locations. We've also shifted to spending more time in immunizations. The large part of the client population that comes into immunizations are a high Hispanic Latino population. So we're going to immunizations a lot more. We were going once a month, but during the summer, we go twice a month. We do testing at health fairs, which we did this past weekend, and community events as well. We continue to partner with MCOs, which will send us a list of their non-compliant clients, and we'll reach out and kind of shift them or kind of drive them either back into their MCO, or we'll drive them to the immunization clinic when we're there. Next slide, Wendy. So this past week, National Childhood Lead Poisoning Prevention Week, we did door-to-door community outreach in zip codes 21215, 21217, 21218, 21223, and 21214. And we literally are looking at the data from where our highest incidences of lead were for the past couple of years. We were lucky enough, as Paula said, on the 25th to kind of host a host of our partners on a whole day focus on lead. And we were definitely lucky enough to have folk from Frederick, Howard, Talbot, Queen Anne's, Baltimore County, Dorchester, and St. Mary's County. And I'm probably missing Anne Arundel County came out as well. Hopkins came out, and they were in attendance of our lead workshop. We had 73 register and 66 attend. That was absolutely huge. The room was full. Hopefully folk learned a lot, and it was great to see people in person. Want to thank all of our partners, DHCD, GHHI, MSDE, MDH, and the rest of the alphabet soup, MDE, and Transformational Health, which talked about burnout, especially community health worker burnout. Next slide, Wendy. So these are some of the survey highlights, and I wanted you all, this is what the crowd shared with us, and I wanted you all to know what they shared. The community health workers are folk on the front line. They have lots of conversations about mold and can't answer those questions. They want to talk about safety and work around environmental risk. Some folk want to talk about science and the pathology of lead poisoning. And they want more topics on the sources of lead not based in home, cosmetic, and spices. And of course, they asked us to keep doing stuff like that. Next slide, Wendy. So moving forward, we're going to keep doing outreach. Next slide, Wendy. We're going to keep doing outreach. These are kind of the things that we're working on now. And Cliff, one of these is for you. The first is we recently received a list of 4,000 plus demolished homes in Baltimore City, and we're comparing it to our current list of outstanding lead violations. That's the first thing. Second thing is we're implementing OCHN, which is our EMR system, our electronic medical record system, which will hopefully allow departments to more efficiently determine what programs are interacting with clients, so we can not only track services, number of touches to clients and entire families, but so we can bill finally for lead testing and environmental inspections. So it's only taken us 19,000 years, but we are getting there finally, department-wide, having this conversation. Next slide, Wendy. Thank you. Now I am open for questions because I'm sure there will be some. Or not. Paula.
Hey, awesome, Camille. How recent is that list? And
the demolished home list?
Yes, and is that public information?
So I've been told, because we just got it 2 days ago, that it goes as far back as 2006. And I don't know if it's public information, but I can ask. I've literally just perused it and we just started looking at it.
Because I'm sure that's something we would like to have. That way we could remove, some homes from our rental registration.
Absolutely. I will reach out and ask, can I share it? It's
Thank
a
you.
long list.
Cliff, your hand is raised.
Yeah, just a couple of things. First of all, Camille, just awesome work to you, GHHI, Candace, the folks here at the health department for a fantastic summit. I mean, really just fantastic. And so thank you for that. Thank you for all the work. Like Paula, I think that we really, with respect to the housing demolition and abatement issues, that's something that we're interested in looking at as part of our review of equity across the state. And so this is something where I think that we, MDE, you, and our partners at DHCD would benefit from being able to look at that list together with statewide abatement data to see where we're not doing as well as we would like to, and to ensure that we are meeting equity goals as well. So that's, I think that for the state as well as for the city, that collaboration could be incredibly valuable in the coming year.
I will certainly ask the question. Great idea.
Mangela, your hand is raised.
Thank you, Camille. That was a great presentation. Loved the first two slides about the social determinants, especially focusing on the Baltimore City. We'd love to have those slides, please. And also thank you for the great summit you arranged, and you brought positive energy and can-do attitude to everyone to say that, hey, we are in this together and we could do this. So chip in and do the great work. So that was very nice. Thank you. And third one, you said with the 2023, with the lead exposure, 73% was found to be from the old building built from before 1950. But also you stated that you have Baltimore City Health Department have to literally beg the families to let you guys in to do the home visiting. I think there is some disconnect there, knowing that these buildings are built way before 1950 and 1978, and knowing that children are still living there, pregnant women are still there, and in addition to the social, economic stuff that they are going through. Is there something we could do as a policy or regulation to make it as a requirement that, hey, when we find something that is obviously injuring the children and the pregnant women, we would like for you guys to let us in so that we could help you. So I'm just asking whether there is any kind of policy initiative from this group that we can start, or is there something that we are not aware of? Thank you.
So I will speak to this just a smidge. They are the people that I spoke of are like outliers and misnomers. It's usually between 5 and 10 people a year that just will not let us in. Most people will. We get further with gentle nudging than we do with the forceful hammer. There only been a few times where I've had to literally push myself in the door and or reach out to the landlord. For the most part, we get in, but those outliers are the ones that kind of send our numbers through the roof, Mangela. Also wanted to mention that Steve Hamola from DHCD Baltimore City, who shared the list with me, is going to confirm that the demo list can be shared so he can circulate it, because I got it from him. He's on the meeting.
Thank you.
Any other questions? Thanks, Ruth Ann. Thanks, everyone. Hey, Catherine.
Hey, Camille. I wanted to know when your next blood lead testing event will be. If you can share that with me. I might have some clients I can send to those events.
Absolutely. We'll be right over at immunizations, and I will actually make sure the commission has that, but I'll send it to you.
Okay, thank you.
Thank you.
Okay, Paula, are you there? If you are, you're muted.
I'm here.
Okay.
Any other questions? Okay, great. We're going to move on to our next presentation. And for those that you don't know, we have Dr. Frederick Banks, the director of the lead program for MDE, presenting information on the 2021 annual report. Dr. Banks will be sharing his screen.
Okay, can you guys see the slides?
Yes, sir.
You're good.
Great. All right, so this is our 2021 surveillance report. Just some highlights from 2020 to 2021. We had a slight decrease in the number of children that were tested. We went from 110 to approximately 105,000. So a little less than 5% decrease for children 0 to 6. The greatest decreases were in Queen Anne's and Frederick counties. It was a very slow, slight decrease in Washington County. But at Queen Anne's and Frederick, we saw 27% decrease in testing and a 20% decrease in testing. Children 1 and 2 were least affected by COVID, appeared to be in testing. Those numbers didn't decrease as much as some of our other kids, 0 to 6. And from 20 to 21, there was a significant increase in the number of children that tested 10 and above micrograms per deciliter. We went from 270 in 2020 to 323 in 2023. That's about 17-18% increase. And then there was an increase in children that tested 5 to 9 micrograms per deciliter from 20 to 21, from about 900 to about 1,100 in 2021, so 200 increase. And then overall, children that tested above 5 increased by 0.3% from 2020 to 2021. So we saw a decrease in the number of tests, but we saw an increase in the number of children that had elevated blood levels. You can see the chart on the right that shows the number of kids that were tested. Once again, the children that were 1 and 2 are the bulk of our tests, which is what we're aiming for. And as children get older, closer to 6, those numbers start pairing off to just a little over 400 for children that are 6 years old. The male-female breakdown is about 49, 50%. And then you can see a little bit lower that children that were below 4 micrograms per deciliter represent 98.6%. You know, I look at this, I'm encouraged because we're close to getting to that 0 number for children that test over 5. But, you know, there's still a significant amount. You know, we look at these numbers, there's still well over, 1,000 kids that test over 5. And then as you look at the 15 and 19 and 20 aboves, this is 1 year we had, in 2021, we had 63 kids tested 20 above, and that's significant. And this is similar to some of the numbers that Camille showed, and what I basically saw that in her chart that increase from 20 to 21 in the children that tested 10 and above. It looks like we'll have, if our data will match theirs, a couple more years of increases, and hopefully we can start dipping down in 23, start getting those high numbers down. But we did see an increase in the number of kids that tested 10 and above. Same thing for the 5 to 9s. If you look 20 to 21, it's a slight increase, but it did increase, like I said, approximately 18%. All right, so this is our 2020 map for children 0 to 6 that tested 5 to 9.9 micrograms per deciliter. The green zip codes are the ones that are at most risk, have the most occurrences, and the pink are the lowest zip codes, with white being the ones that were no occurrences at all. But there are, you can see there were some significant areas in 2020 for children tested 5 to 9. The counties that you want to probably pay attention to if you're looking for any changes is right in the eastern corner of Cecil, Washington, and right around Montgomery, Anne Arundel, and PG, right around that DC area, right around there. You can see some significant changes when we go from 2020 to 2021. So this is 20 and 21. Like I said, the Washington County, the highest risk areas expanded, similar to the areas right around DC. Those areas that are highest at risk expanded a little out some. The issue with Cecil County was that the high risk area expanded, but we had some middle tier areas that kind of moved west too. So we saw some areas that were not affected in 2020 that became a little more at risk in 2021. So for our 10 and above, this is 2020. And same thing, our Washington, Allegheny areas around DC, Baltimore City, a small area in the center of Harford County. Not much going on the Eastern Shore for the highest risk, but there are some risk areas there, right around Dorchester. In 2021, these areas, it may look like it got better, but what I did notice was there are more 75 percentile. So these are areas where 75% of the population is lower than these areas. So those areas kind of popped up a little more in areas that weren't at risk before. So we got some areas that we had to pay attention to. I won't read this to you, but the next two charts look at blood testing by county. And I will say that in 2020, some of you guys may remember Dr. Kayron pulled these population numbers. Shamola and I were unable to locate or match his 2020 numbers. I'm assuming he may have used population estimates, but the numbers in 2021 represent the current population survey by the Census Bureau, and those are accurate numbers. So we weren't able to, it shows a significant drop in population, I think because he may have used estimates and we were using actuals. But you should see consistent moving forward with 2021 through our next 2 or 3 reports using the same set of numbers. But you can see just looking down the list that there was a significant detested numbers. They're right around between 20 and 30% for most counties. But there are a few counties that were above 30, or like 32% for testing. A few more that were in the low 20s. So Paul and I will be using that information for outreach. Now, once again, this is 2021 data. So, but we're going to look at 2022 and 2023 to see if the trends for each county as far as testing numbers and percentages are the same. And this is testing by age group. So you see the percentage of children tested. Once again, 1 and 2 year olds represent our highest number of children that are tested. I believe that we'll see a change in this because of COMAR, I think it's 10.11.4.5. That's the lead certificate that's required for school enrollment now. So we may see some of these higher age groups, as far as percents of testing, go up some as children, get into 3-4 year olds. If they haven't been tested, they may need to be tested into the school system. So. And this is testing by age and by county again. Average test per child is about 1.086. You see a significant increase from 2020 to 2021. I hope that number goes up. We're going to do a big push to have encourage children to get follow-ups and get retested at least twice before the time that they're 2. So we'll be moving towards doing that. So we want to try to get the average up to 2 per child. So this next slide deals with data quality and the information that we get from labs and from providers. You can see that generally we'll get, we're 100% on date of birth and child's name, gender. We have some issues with race and ethnicity, guardian's name, which is critical for us. We spend a lot of time trying to track down the information. The medical information is for our sample date, test date, blood lead level. These are things that we almost always get, but definitely we spend a lot of time working with our inspectors and our surveillance staff on the phone trying to get the parent's name, because we have, we can't just talk to anybody about a child's health. So we have to make sure we have the right people on the phone, and we're communicating to the right people when we schedule environmental investigations. So we'll be working with our partners at the local level to try to help us wrangle some of this information. This is our medical and environmental case management information. So we collect information from the local health departments on the medical outreach and in-home versus telephonic counseling they do for families once they've been have a child that's been identified as having an elevated blood lead level. So we're about 54% in 2021 for being able to reach families and talk to them about issues. And this is all Maryland counties excluding Baltimore City. So a significant number of families we were unable to contact or moved, and then we had about 14 that refused. These are the environmental investigations. So we got a total in 2021, 564 referrals. We were able to complete 250 or 249 environmental investigations. So it's a little less than half. We were unable to contact 158, 128 refused, and about 40 moved, or we had an incorrect address.
Fred, I have a question on that. Could you go back to that last slide?
Yep.
On refused, what data are you collecting in terms of refusal? Are those refusals in writing? Are they by phone call? And what reasons are you recording on the refusals?
These are refusals by phone call primarily. Some of the reasons are they're taking care of it themselves. Some of the reasons are they're in the process of moving. There's a very number of reasons. I would anticipate, and one of the issues we're working on is identifying a refugee population in our data. I would say probably about half of those numbers are refugees or people that are new to the country, that public trust of government agencies is an issue and they just don't want the government in their homes. So that's probably, I would say, anywhere from like 40-45% of these numbers.
Yeah, I'm going to push back and say this, right?
Uh-huh.
Is that anecdotal or is that real data on that? I mean, I think it will be really super important and to help you and support the department to have really firm data on whether these are homeowners, renters, whether they are, if they're at the refugee population, to try to confirm that in data rather than to do that anecdotally. I think it would be in the best interest of everybody and the department to make sure that the data aligns with that. I know you're very skilled at this and your anecdotal might be and likely spot on, but I just encourage to have really firm data in recording why we're getting refusals for services and what it means in the unable to make contact, I'm sure you do have a protocol of how many times you call or a certified letter or something that just tracks this in a way, because these are high rates and they get coming out of COVID, the world is a bit different, right? But I just really encourage that we have really good data tracking on the refusals or unables to support staff from any criticism.
Right. I totally agree, Ruth Ann. I think one of the things that's going to help us out, this is 2021. As of now, we have two data management systems that are totally new to MDE. One is HELPS, the other one is LRCA. And prior to this year, we didn't have either one of those in 2021. So there are what we call event codes that will allow us to basically click and identify this is the refusal type is actually event code. One of the things that's not in our new database that we're working on getting added is identifying whether a person is a refugee or not, and identifying whether a mother is pregnant at the time that they have a child, that they get lead tested. So we're working with our partners at the providers, physicians, and labs to see if we can get that added to our lab reports on whether an adult is a pregnant mom. And then also on our end, adding that into our data management system so we can track that information more accurately. But yes, I totally agree with you.
And I'm gonna also say, and Chris, I see your hand went up, but I do think, Fred, this is where community engagement with community-based organizations and the department can be helpful if the department goes back out to do that at some point in helping to establish trust in the community about this. If you see particular communities that we're not getting response from, I really encourage engaging community partners to help on general education around what MDE does, etc. I think we have a hand from Chris Corzine.
Yeah, I just wanted to note for everybody that the department does file the regulations with regard to scheduling environmental investigations, which includes the closure of a case. Those are at 26160805. So there are protocols set forth in regulation the department follows. So when those cases are closed, they are following the procedure they are required to do so before they're closed.
Okay. I'm not sure everybody knows what those steps are, but maybe we can get some information about that out in the future.
Sure. It's at 26160805 is specific regulation that governs the scheduling of environmental investigations, and then Part D specifically advises that the department should close a case upon certain triggering events or non-triggering events, I guess, in terms of failure of guardians to cooperate. So that's where they are if people want to see them.
That'd be great. And Chris, can I encourage you, please just put that in the chat. So anybody who wants to look at that could do that, and that would be great. And thank you.
Sure.
Okay.
Thank you. All right, I will add that as a part of our outreach, Paul has been great. We just, once again, we finished doing a lot of outreach during Lead Week. we also, I think we have something coming up tonight, Paul, out in Western Maryland. We're going out to do an inspector contractor forum. But I think the highlight for me for the week was Paula reached out to Pratt Library, and they have story time for children and families. And it went over, it was amazing. So they've already called me at least 3 or 4 times trying to set up other locations. So we're going to use as many vehicles as possible to reach out to families to try to build that public trust, to make sure that we have MDE gear and that families and children recognize us as an advocate and not an adversary. So
Great.
So this is the number of referrals for, this is medical case management for 5 and above. This is Baltimore City information for 2021. We can see that there was 151 either in-home or telephonic outreach accomplished, and we had 120 that we were unable to contact or had moved out of the city, and we had 7 that refused. And these are environmental investigations. We completed 98. We were unable to contact 113 for the environmental investigations, and 67 refused out of a total of 278. And this chart might be hard to see, but this is just that same information by each county. And I think Wendy's going to make these slides available for you guys so you can have a look at it. But Montgomery County was approximately, did a total of 249 environmental investigations in 2021. 98 were from Baltimore City, 61 Prince George's County, 37 Montgomery County, Montgomery County. Baltimore County was 52, and some of the numbers are a little lower than that, but those were our largest counties for environmental investigations. This is our source by county, distribution of sources by county. Lead paint was, significant for just about most of the counties. Other key sources here to look at was cosmetics, spices in Baltimore County, Montgomery County, pottery and cookware in Dorchester. There's other sources like lead dust in Baltimore County, Anne Arundel County. But it's you can see, and just from an eyesight, you may notice that possibly the more diverse culturally a county is, the more diverse the sources will be. So we're looking at various sources, new sources, and updating that information for the local health departments. They'll help us kind of identify ways that we can address these in a different way as far as outreach. But we're always looking for different sources in the home to alert families of what they need to look out for. And these are owner-occupied housing for 2021 by county. I'm sorry, by Maryland. This is all the Maryland counties. And lead paint for owner-occupied pre-1950s was clearly significant. And you see some soil and water in post-1977 homes. And then spices in both owner-occupied and for 1950 to 1977 homes and pre-1950 homes. These are rental units for 2021. Lead paint, clearly significant. We do have a significant amount of unable to determine. There, we were able to identify that there was probably a third of our environmental investigations where when we went to secondary homes or secondary places that children, this is grandparents, aunts, uncles, friends' house, cousins, other places that we were able to identify sources in other places other than the primary home. So our inspectors do a great job of doing detective work to, work with the case manager to kind of find out what the pattern is for the family, where kids spend most of their time, what, secondary places that might have the hazard that, may be affecting the child. So. Just let hazards identified by housing type. So you can see, once again, pre-1950s are significant, significant environmental hazard to our kids, both for lead paint and dust, and even the ones that we're not able to determine. So. Okay, so some challenges. We know that we have to work on getting that denominator down as far as population, and working with the counties and the lab providers and the physicians to collect that missing information and coordinate with our IT department to make sure we got the correct event codes so that we can track our refugees and pregnant moms. We just went through a big migration from one operating system of Stellar to Helps. So we're still working out some of the bugs. We meet with our IT department weekly to make sure that we're moving data properly, and we're still running tests on our 2022 data. We're trying to get, actually Paula and Dr. Boss will be heading out on the road to some of our county health departments we're trying to push a paperless process for sending labs to us. So we'll be working with the labs, working with our providers to try to provide a way for them to send us labs electronically. We still get a significant amount of paper labs that we send to a vendor to input for us. So we're trying to take out the middleman and make sure that we can get those labs quicker and more efficiently. And I already mentioned identification of refugees and pregnant women. So we hope to get the 2020, and this might be, I might have bumped these up. So we're looking to get the 2022 report January next year, and then have the 2023 report done by the spring. And we want the spring to be, and when I say spring, I mean like early to mid-March, to get those annual reports out to you guys sooner. We traditionally have, the way our reporting year goes, we will generally track a child through February of the forthcoming year for the previous year. So the data that you saw includes all of 2021 plus data from January and February of 2022, because children that generally are tested in January will get retested in January and February. So there is some carryover. So we want to make sure we get all that data in before we report. So, all right. Any questions?
Fred, is there any possibility of getting that 22 report out by the end of the year?
We're really pushing to get that out, but we just, part of what we're doing now, that the 2021 data came out of the Stellar database. We're now in 100% help. So we just want to make sure all that data has been cleaned and that we're giving you accurate information. So I can get back to you on that, but the goal is to have it out by January at the latest.
So I know the EPA Chief Act that I serve on was looking for the MDE reports for 21, 22. So as soon as we can get those, I think it's going to be quite important, because they're doing a charge question on lead, and they're getting data from states around the country, and would be really quite important.
We can work, we'll definitely work to get a preliminary report or draft to you guys as soon as possible. I'm sure we have, I want to say at least about 98% of the data collected and cleaned. So I'll work with our team to get that draft out to you guys as soon as possible.
Well, I'm just going to say again, I think one of the things that I know I'd like to help the department drive down is the number of inability to get in for environmental investigation or otherwise. It's a pretty high number I'd like to get down. Anything that I can do or any of the commission can do to help improve that number really critically important, but I think it will help to have touch points on the data on this as much as possible. We have a hand from Barbara Moore.
Good morning. Trying to figure out how should we best advise parents who everything in the home seems to be okay, except for the spices. And we advise them to not use the spices, obviously, that tested positive, but we'll have one family that have cumin, chili powder, and something else that tests positive. Another family, there's 3 other spices. It depends where they've bought it, it seems. Should we just make a blanket statement to everybody? Don't use any spices that have a reddish or a bright yellow color or from anywhere? Or do we know yet? Have we been able to establish any pattern of like which ones they really should not be using? Because I currently have a parent and the child's blood level's not coming down. He's like, no, I don't buy any of that stuff anymore, except at the market. And we're like, okay, which market? And it's the Indian street market. And I'm like, no, don't buy there. Nope, that's all natural. So it's safe to buy there. And trying to emphasize like where to buy their spices.
Well, and I think, Barbara, there's other things like the pouches, right? That I'm really concerned that we look at, but Cliff has his hand up as well.
Yeah, Barbara, I guess I would say, working with MDE and our Office of Food Protection, we have historically identified a bunch of different spices that are problematic. But this is a problem that comes for 2 reasons. One is because, especially in certain international markets, there is less control. The FDA is sort of chasing, but this is whack-a-mole in certain respects because they just are in the food supply. Major manufacturers who are U.S. manufacturers who are in domestic large-scale grocery stores basically are aware of this problem and have pretty good manufacturing processes and control. But a lot of the internationally acquired spices, both chilies, turmeric, and then combinations that include turmeric, particularly with lead chromate, there's just no way that either the FDA or the state can monitor all of that stuff on a regular basis. So I don't have a good explanation. I don't have a good answer to you, except to say I am fairly confident about the integrity of the U.S. manufacturing process because of controls by the FDA.
Okay, because we have had a patient and one of them was a McCormick product and several, they say they buy their product at Costco or Target.
Yeah, no, and I'm not saying that those are 100%, but in general, on the odds, you're much better off going with a domestic manufacturer with a labeled product. Bulk product is more problematic, and bulk product at international stores is probably where we've seen our greatest challenges.
Okay. Does anybody have any strategies to convince the families to stop buying there besides telling them, and they still do it?
You know what? That's a really tough one. And Fred, I don't know if you have anything else that you want to say on that, but that's sort of our experience from the food protection point of view.
Yeah. Okay. Okay. Thank you.
Mangela, your hand is raised.
This is to Barbara. I agree with the spices, but I'm wondering if we are talking about the 1-year and 2-year-olds being exposed to these spices, is it the consumption or inhalation? Because normally the 1 and 2-year-olds may not be able to eat these spices, any kind of like food items prepared with these spices. So how much they might have consumed for their blood level to be increased. So is it the mom, the children got it from mom when she was pregnant, or I'm just curious.
Right. The parents are reporting that they actually use the spices even in the food that the children are eating, and the 1 and 2-year-olds are eating. They use it in the soups that they prepare. The few parents that have been able to convince the moms to go get their lead levels have been okay. The other issue, and the thought I was thinking is, even if it's a small quantity because the child is so small, maybe that's what makes it a more significant increase. They also use some of these on their worship tables or altar areas, so burning and then the smoke from that. But the big thing was trying to convince them. We've had an easier time convincing them to stop using it in their worship area than we have. And they just go somewhere else and buy it. And I suspect they're still positive because they're still going to one of the international markets, unfortunately. Because they'll say, yeah, they're in the little Ziploc bag and they think it's fine because it's being advertised as all natural. And it's like,
yeah, I think we got to look at both sides of this, and we ought to dig in a little bit with both. And Barbara, I think there needs to be some action with these big retailers to look at it, FDA, and put some pressure on FDA. So maybe the commission can also, I suggest, send a letter to our federal delegation to ask for assistance with the federal agencies in looking at this, as well as putting some greater looks. But it's unfortunate that there is this pervasiveness. Housing still the main culprit, but these additional sources are troubling for sure. Do we have other hands up? I think we do not at this point.
I think.
I have a question.
Yes, John. How are you?
Good morning. One of the questions I had too is that I noticed that like in some Asian markets, oftentimes like on items and products like seaweed, or there are labels that talk about the level of cadmium or certain heavy metals that are in the product naturally, because some products, depending on where they're grown and how they're grown, absorb certain levels of lead, or not lead, but certain levels of heavy metals. And so one of the questions I had is it like, and this goes back to my earlier question about labels. Like I noticed California has a lot of labels on products, whether it's food products or even products that you get from the auto store. There's a lead warning. California has a lead warning, but
on
also
Christmas lights, right?
Right. And so when you look at certain products like food products in Asian markets, they oftentimes do have warnings about cadmium or warnings about certain heavy metals. And I'm just wondering, is it possible to have those labels on certain spices and food products?
I think that would require, in Maryland, it would require legislation like California has, and it's something that perhaps should be looked at. I don't know if the health department or US or the MDA, Maryland Department of Agriculture, has looked at this as a potential aspect. Cliff, do you know? And maybe we should have MDA come and present to us on what they've looked at here. Spices and food would come under them, right? Wouldn't it?
So it would come under us if they're processed here in the state. But remember also that this is subject to federal regulation. If these are in interstate commerce, then it's under the Food Safety Modernization Act. It's a combination of state and federal requirements, and the labels by and large are a combination of those two. California does have a warning label requirement, which is somewhat unusual in the country because there's such a big market. We don't, and I suspect the Department of Agriculture as well, want to be careful and just from a practical point of view, supporting food manufacturer, we want to make sure that we don't unnecessarily cause any repercussions for them. At the same time, it's a useful question, but it would require legislation. We don't have statutory authority to do that right now. So that is not a thing that we have authority for.
Do you have suggestions where we might look?
Well, I would look to California because they have done it, and understand what it is that they did and how that happened.
Okay. Okay. Other questions? We will take a look at that, and I think should look at that. Barbara, if there's some anecdotal data that you can share out of your practice of what you're seeing percentage-wise, it'd be helpful to share that, I think. I think all of these issues, right, are related. Some of the issues of refugee populations, we know, Fred, I think from your investigations, we're looking at spices and these type of materials. I don't know what we're seeing in other populations, but we ought to pay attention to those things that we can do a better job, even if it is outreach to the Asian or other markets, other ethnic related markets, to talk to those grocers and see what we can do at point of sale, even education wise, to be careful.
Hey, Ruth Ann,
Don't know the answers yet. Yes, Adam, go ahead.
Just to jump in, I'm sorry, but I agree with you 100% that, I mean, with all due respect, putting another warning label on a package, especially for kind of the immigrant refugee market, doesn't feel like it would have as much genuine impact as talking to the grocers or putting that. I mean, because then you really need that warning to be in whatever language those folks are speaking. And I agree with you 100%. I mean, I think that's a much better approach to kind of attack a problem that's a real problem. It is genuinely an issue.
Yep, I think we've got to think about how to be aggressive on a number of these things and kind of light some new focus on these. And not things we anticipated maybe 10 years ago handling as much. So we've got to just revamp our look at things. Susan and Barbara Moore, and then we'll bring this discussion to a close.
Okay, thank you, Ruth Ann. Sorry for the voice. I was wondering, Fred, if since lead-based paint and lead dust seem to be the biggest contributing factors to elevated blood lead levels, is cleanliness of the house a criteria that is captured? Because what I see is that house cleaning is usually an issue in where there are elevated blood level children. Thank you.
Yeah, we've seen it on both ends. I mean, I think I think instead of cleanliness, we look at activity. So if there's a lot of movement around the house, windows going up and down, people bumping into things, releasing, moving furniture around, those seem to be more contributing factors when it comes to lead paint and dust and cleaning. But we make some documentation of the care of the house, but we try to stay away from any judgment on whether something is clean versus dirty. As we will use terms as far as the frequency of activity of things, how often things get moved, furniture gets moved, how often families raise and close windows, creating that friction with the paint, opening, closing the doors, rooms that aren't used versus high activity rooms, things like that. So.
Just as a follow-up, I was just wondering, because I thought it used to be required as part of an assessment for Section 8 programs for, capturing data on the cleanliness of houses. And I do think that as we move towards lower and lower dust standards allowed, I think that the participation of cleaning on the part of the occupants is going to become greater and greater. And
there's going to have to be a lot of community-based education going on here with regard to that. There's no doubt. Just a question, Fred, I think that Barbara raised. She's saying that, and Camille's responding some, and maybe Paul is going to respond to this, but a question about only 3 spices being able to be tested. Is that a city or a state issue there?
Yeah, I'd have to check on that one. And I'll get with Jonathan about this after meeting, but I'll check on that and get back to you guys on that.
Yeah, for a while the city did, and may still be doing it, but I just don't see it. But when Lena Wynn was the commissioner, we got a MDE inspection, she said. So just so you know, Fred, but we were sending out alerts a lot about costume jewelry. And I'm wondering if the city and the state have the ability to do a, sort of a broad spectrum of testing here on these things to send out any alerts. But the city did a great job of that for sure. Paula was first, and then Cliff Mitchell.
Thank you.
And thank you, Paula, for covering while I had my
oh, you're welcome.
$15,000 estimate for my roof.
Oh my God.
Yeah.
Sorry.
Yeah.
Anyway, two things. The one thing that we have to realize is that we do have control of the spices, as Cliff alluded to, when we are aware of the bulk code on the spices, and we have addressed those. The problem comes into fruition not only from the markets, but when people bring the spices in from other countries, which illegally probably, for consumption. So that's one thing I do want to address with that. The second thing is health education about cleanliness. That is something we do capture when we do the environmental assessment. However, I do want to mention that as part of health education, our community health workers and our nurses are required to review that information with the families, in addition to nutrition and other things. So that's just 2 points I wanted to make.
Okay, and then Cliff, I think you were up.
Yeah, and actually I was not just piggybacking on what Paula said. It's impossible for us if the family brings in materials. We've had this issue with mercury in face cream. We've had this issue with lead in cosmetics acquired overseas, lead in spices. So Paula's exactly right. If it's in a retail establishment, we can do it. And so Baltimore City used to do blind purchases, random purchases of jewelry and toys and other things, and send those for testing. I believe some of those were actually sent for testing to a commercial lab in some cases in the past, right, Camille? And so that is an opportunity. The state lab, the state public health lab, and MDE's lab don't necessarily have the capacity to do that kind of matrix, like a toy and stuff like that. So in that case, I believe that in the past they actually sent them to a commercial testing laboratory.
Well, I think this needs definitely a further look, and we ought to organize a way to do this. So I want to consult offline on how we might do that and propose how the folks on the commission can help. But I know that we should be quite concerned about these sources that are getting for babies. I know there's also, Fred, I notice you're really wanting to check on the status of not only refugees, but pregnant women, and hopefully that you're connected to the OBGYN practices and the family care practices on that. So maybe something that you and the health department can talk about on how do we do that, as well as the obviously self-identification, but big believer in that preventive education in early pregnancy as well. I noticed that on your slides. Wendy, what is on our next agenda item, please? And
So
thank you, Fred, for your presentation. Very, very informative and gives us a lot of meat to focus on.
All right, so next up we have agency hot topics.
Okay, I don't think Tyler Abbott is on.
No, he's not on. Paula, do you have anything?
I don't have anything, except I want to thank you, all our partners, for a very successful lead week I want to thank Candace Scott and Chevelle Bash for leading the charge in Lead Week, and I thought it was a good collaboration that's only going to get better. Thank you. Oh, I do have another question. I'm sorry, but Jonathan Riddicks, who had a comment earlier, I'm just wondering what organization you're from. I apologize if
I think
we
he
met.
hopped off. He had to.
He's with
Maybe he's
DHCD
not.
in Baltimore City.
Yeah, I'm here.
There he
I'm
is.
with the Department of Housing and Community Development, Code Enforcement, Legal Section.
Okay, thank you.
Love that. And Jonathan, can you give my best wishes to Jason Hessler, please, who's been such a long, good stalwart there too. Yeah, and thank you for being on. Code enforcement is so critical, and I'm so encouraged to see the advanced work that's being done. CDC gave a grant to Camille and the city to enhance coordination between the two agencies there, and I think it's just such good leadership that we're doing that. Thank you for that, Camille. MDH, anything else to add?
A couple of things. We are continuing to work on our equity assessment of the lead program across our various product lines and service lines, including our home visiting program, our collaboration with Medicaid and DHCD. And we are going to be working with MDE as part of that. And as Fred reviewed all of the testing data that from the last reporting period, we're going to be working with MDE on outreach. We're working with Baltimore City Health Department, and a big shout out to Camille and Margaret Schnitzer. We have a preventive medicine resident, as I mentioned, who's working on how to engage with providers more directly through essentially detailing on lead, asthma, healthy homes, and make providers more aware of that. And I think that we have some other things in the pipeline that are probably a little early, but I think potentially could be of interest to the commission. The other thing I will say is that, again, thanks to ASTO, we are providing a second year of funding with the balance of the funds from the $500,000 that we received last year. We are providing funding to 13 local health departments that are not currently participating in our Medicaid home visiting program to support case management activities. So it's not a huge amount of money, but about $15,000 per each of those local health departments is going to support case management activities, because otherwise those activities are basically not funded except through other sources like Title V or other sources. So that's a nice opportunity to provide additional support to those local health departments. And then the only other thing I will say is I'm eagerly looking forward to working with MDE as they roll out HELPS, the Healthy Homes Lead Poisoning Surveillance System. We're planning to work with them to engage our local health departments in thinking about more effectively linking case management activities to prevention activities and to improving our visibility on case management activity across the state.
Thank you. Paul, anything?
Yes, good morning. Just a quick little thing. I've shared emails on occasion with Shakora Galen. She's head of the California Preventive Program for Lead Poisoning. Recently, we shared her emails back and forth about lead testing of water in schools. I'll send an email to her and see if I get some more information about their labeling process and so on too.
Thank you so much. I appreciate that and your continued just amazing advocacy. Office of Child Care, Manjula, anything else to add here? And we appreciate all that you do.
Thank you. I was excited yesterday to receive the message from the Johns Hopkins Ideals, with whom we collaborate to do parent surveys. Recently, they conducted a parent survey of the children attending the childcare programs, and we expected 300 participants, but we were told that there were 600 parents who participated in that survey. I inserted the question about the lead testing and the barriers and the challenges that they experience in taking the children for testing. So they said the results are available. I'll be excited and happy to share with you all when it is published with us.
We will count on that, and thank you. And that is great. It just shows that people do want to be, I mean, when you ask, they will engage with you. So it's so great. And thank you. Benita?
No, nothing.
Thank you. I know Jack Daniels stepped off. I don't know who is here. So Catherine Taylor or Nicole Hart, please.
Hi guys. No current updates, but we have been trying to focus on our vulnerable populations at the moment, such as immigrants and refugees. We have been working with the mayor's office to translate all of our materials in our application so we can reach out to these populations. We've also been working with a lot of stakeholders that are immigrant friendly to help us build that trust between those populations, which has been going pretty well. So that is where we are right now.
Catherine, do you have an update on sort of where you stand on the number of units and the lead grants that you have? Is that something you could provide to the next meeting? I know we were supposed to do that a couple of meetings ago and it got skipped. But it would be great if in December you could do that for the commission.
Sure thing.
Thank you, ma'am, because I don't want us to forget also our, it's really important to focus on refugees, but we've got a lot of residents of the city as well that are in need of lots of help, and both great things. Camille, you noted candy in your comments, so I guess you'll illuminate that here as well.
No, one of the things Cliff mentioned was their spices, but candy is also one of the things that we have found a lot of lead in that immigrants bring in with them. And we check and check and check, and sometimes it's been the candy. So I wanted to put that out there. But we are embarking on an old but a new relationship with the Maryland Homeschool Association. So we're trying to figure out what that looks like and where we're going with that. But we're excited. They reached out to us and want to just have some conversations about lead. So we'll let you know what comes of that.
That is amazing. That's a great, that's great. And any help you need, let us know. And Wes or Chevelle, updates from GHHI?
I just want to echo the thank yous for Lead Week, the statewide efforts by everyone. But I wanted to make sure that people know that in the state lead grant programs, the city's programs, we also have intake and staff to do outreach and case management to help people access those resources. So especially if they're people who are homeowners or rental property owners or tenants, we can also help them get into those lead grant programs, assist them in connecting with the resources. And then here in Baltimore City in particular, we'd love to have other referrals. We have $2.5 million in Baltimore City ARP funding that is focused on lead hazard reduction. We're doing healthy homes to address lead hazard, other healthy homes hazards, as well as weatherization and electrification. So not only making the house lead safe, but we're also helping the family be financially stable to stay in that home long term by addressing other hazards and structural defects and weatherization. But we do have $2.5 million in ARP funding that we can directly put to work on lead, in addition to the city's $13 million in lead funds that they have. So yeah, please keep sending referrals and we'll get them to the right resource, either here or also with our partners.
Well, it's actually closer to 5 million because we have congressional funding that goes into that. So really reaching out to concentrate and can be a little bit more flexible around the work. And want to be on the prevention side where at all possible. Definitely also want to just share, if for those who are here from various agencies, we are doing a study with Hopkins on injury prevention, and we are looking for 300 families in Baltimore City and Baltimore County, where we will provide injury prevention remediation measures for children 7 and under and their families. And if you have any families that might wish to do that, it includes changing out mini blind cords or mini blinds, putting window guards in, grab bars, etc. Injuries are happening not only to our older adults that we often concentrate on, but our kids and the Injury Prevention Center. As for any of our grants, when we are looking at asthma or looking at injury or looking at weatherization, we're always looking for lead in the house to remediate that together. And tomorrow, with Fannie Mae coming to town for a site visit, we have a Maryland MDH asthma family that was identified. We did the asthma work and then landed up doing much further work around prevention with them. So thank you, MDH, for that support and the work being done together. I just want to add my thanks to everybody on really creative ideas that I've heard around outreach coming from MDE and the Pratt Library, from the city and the homeschool. I love the fact that we are thinking about finding and forging new ground, and so important on that. Any other, Camille and Barbara have your hands raised, so please go in the order that you raised your hands, please.
Just very quickly, Steve Hamola from DHCD said he can share the demolition list with Cliff and Paula. Is there anybody else?
If he would share it with us as well, because if we are going next door to houses where there's demolition being done, it's important on both cleaning and updates and ensuring that we do prevention work.
I will send an email shortly and CC everyone and have him respond. No problem.
Thank you. Barbara, thank you, Camille.
I just want to write, we definitely have had an increase in the number of children that have been referred to clinic. I think we're up to 46 or 47 new referrals just since January. And we reach out to Baltimore City and the state for inspections being done quickly and responding when we're asking for the reports to be sent to us. It's been great. Thank you to Green Healthy Homes, the city, the state, everyone. We've just recently had a very, very complicated case, which required family to be relocated into a hotel. So that went well, sort of. He's safe. Lead levels are decreasing for 2 children in this family. And we currently have another very complicated case with a child with a very high lead level that involved Healthy Homes for Healthy Kids, Green and Healthy Homes, Baltimore City, and I will be sending out a follow-up on the mass email, see what our status is for all of those. But thank you to everyone for prompt responses.
Well, I think Mount Washington and Barbara, you do an amazing job, not only on the treatment and case management side, but what an amazing advocate you are to get systems there and paying attention. I do have to raise this. I will raise it every single day. The state has got to get money out for legal services support for families. It just does not exist. Organizations like GHHI, who are currently doing it pro bono, don't have money for that. And so it's coming out of our reserves, which we're happy to do, but the state should have a better system of support for this. And families really need it to be preventive. And it will help all systems for us to do that. Cliff?
Yeah, and I just want to follow up on Barbara's comment, because I think it points to one of the things that we've talked about in the past that I think it's still worth thinking about, which is because we have not solved the lead problem. We've not even solved the lead problem in lead paint in the state. So just to be clear about that, one of the things that we do know happens when you get when you've done a good job of tackling the sort of part of the problem that is right there in front of you, relatively clear, is as you get into some of these cases that are more complicated, the cost per case goes up because these oftentimes are multiple sources. They're harder to find. You end up spending more time looking for the cause or causes. And we need to think about, as a state, we need to think about the fact that in some cases, these are going to be very expensive, potentially, problems to fix, especially where we've got multiple discrete sources of lead exposure and kids, not always with high lead levels, but kids with low lead levels with multiple sources. So we really do need some careful thought about how we manage those from a case management point of view and how resources are allocated. And from an equity point of view, I'll just finish by saying it's still not clear to me, but I think we really need to have a thoughtful discussion also about, if we're spending a lot of money on a few very expensive cases, are we doing so potentially at the expense of a larger number of children across the state? And so I really think that that is a complicated question.
It has been the one that I've had about how do we best maximize the Healthy Homes, Healthy Children's CHIP funding and other programs, right? And at what point does permanent relocation really matter? I just want to say I am very grateful that Baltimore City has maintained the Housing Choice Voucher program for lead-poisoned families with levels of 3.5 or above, and how unique and amazing that is. I was with the mayor of Detroit this week on things that they are grappling with in Detroit, and when I mentioned the Housing Choice Voucher program, his eyes lit up as one of many things that we do, but we don't want to even be at 3.5, right? But I do think, Cliff, this bears some real look at what we are doing around this. Now, on programs like Our Whole House, right, we've raised money that is more than the $5 million that between congressional and ARP money to bring in to do some of that work so that we can look holistically. But I do think, and we've seen some extraordinarily high costs here, that we've got to really analyze what are our alternatives. And I think we have to figure out how to do that quickly, because we will eat up these resources and make sure. But one thing we do have to also revisit, and the reason I brought up Housing Choice Voucher, is it's also really important that for those houses that are Housing Choice Voucher eligible, we have to do a better job of making them lead-free and lead-safe, because I know for a recent case that we worked on with Mount Washington, I think the family must have looked at 10 or 12 houses that would not have passed muster. So how do we put money proactively into housing, and what standard are we setting for those supported by Housing Choice Vouchers, that they be safer and meet a higher standard and not have a lower standard? So lots to unpack there too, and look forward to us being able to do that. Cliff, go ahead.
Yeah, no, just one other quick comment about that. And I think we need to recognize also, in many cases, home equity for these homeowners is one of their major sources of wealth. And so if you end up essentially condemning the house because you've permanently relocated the person, that is potentially a huge equity and help and resource taking from the family.
Yep. I mean, that is the complicated piece here, right? And I'm more on the relocation side. I was thinking on the rental side than the homeowner side, obviously. But taking away on the homeowner side would be something that we would not want to do as a goal of intergenerational wealth transfer. Shanika had a thumbs down on something. Shanika, do you want to comment on what you put a thumbs down on?
No, that was a mistake. I'm sorry.
Okay. Okay.
Thanks, Shanika. I thought, oh, that's bad.
No. Sorry about that, Cliff.
No worries. Okay. But I do think, Cliff, this is something that maybe we could bring the Healthy Children's Program, Homes Healthy Children's Program forward and look at the average spend and the average cost and decisions. I think really thinking through those decisions are critically important, but appreciate the homeownership support that is the result of disinvestment in communities, right? And disinvestment in wages that have put people in this position. Chevelle Bash had put a note up on an event happening at the Mondawmin Mall, and hope you all can join on November the 11th. That we'll do preventive health screenings happening on lead there. We are all looking at how do we get more effectiveness in community outreach to actually drive applications for lead hazard control, lead abatement, and we're looking at that. I hope Paula and others, as you do your outreach, that you have those resources at hand that you can refer for getting these units done. We don't want to let this money sit and not be used to do cleanup. So would appreciate the partnership there. I think if we don't have anything else, Wendy, are we at the end of the agenda and the end of the meeting, I believe?
Yep, public comments and updates, anybody? If none, then we can motion to close. Nobody?
Seeing no one, can I get a motion to conclude the meeting, please? Cliff, do you want to give me a motion to conclude?
The end meeting.
All right, Barbara, great.
Second.
All right, all in favor?
Aye.
We are concluding the business for the November 23 Lead Commission meeting. We look forward to seeing you in December. And thanks everyone for your work on primary prevention. Thank you.